welcome to Facebook Live. It's all things Illuma with our nurse Lily here at Beautology today. So we are going to be talking about the Illuma laser, who it's good for, what it does, and all things Illuma. So you may have heard about this treatment, you may know a bit about it, or nothing at all. So hopefully we can clear all of that up today. So this is our wonderful registered nurse Lily.
Hello.
This is our beautiful patient Michelle, who has so graciously given up her time today to be on Facebook Live with us and try out Illuma for the very first time, so you'll get a nice, real, honest opinion of how this works and what it feels like. So I'm going to turn the time over to our nurse Lily. That way she can tell all of you viewers about what Illuma does. So Lily.
All right, so this is our Illuma laser here. It's a radio frequency laser. So what it does is it stimulates collagen, and we work on areas such as the eyes, which we're going to be doing on Michelle today, such as the gel area, any area that has some laxity, because what it's going to do is it's going to tighten the skin in the area. Normally patients need 6 to 8 treatments, and you can do them about 3 to 4 weeks apart.
Okay, so Illuma, what I'm hearing, Lily, is Illuma is good for everyone.
Yes, it's good for everyone because everybody needs a little bit of collagen stimulation.
Absolutely. So what Lily's going to be doing is administering of the Illuma treatment right now on Michelle. We'll kind of go at a slower pace. That way we can introduce questions from our viewers, and Michelle can give us her feedback about what she thinks about Illuma and how it feels. So Lily, if you don't mind, let's go ahead and begin and start treating with the Illuma. We'll kind of stop and interject and take questions as we go. So
we are definitely getting a lot of hearts, thumbs up. So we are building our viewers. Everyone is so excited to see this treatment, Lily.
So this is a little bit of conductive lotion that we're putting on the area.
Why do we need conductive lotion?
Because the way the laser works, it needs to suction up the skin so that way the radio waves, get to the skin and stimulate that collagen.
All right, Michelle, we have someone shouting out for you. Desiree says, "Hi, Michelle. I love your hair."
Oh! Thank you.
I know she looks great. She's definitely camera ready today.
We have another question coming in, and this will be for you, Lily. Is the treatment painful?
It's not. It kind of feels like a warm massage.
Who wouldn't want that on a Friday afternoon?
Right? We'll let Michelle be the true judge of that because we're going to get going here soon.
Are you ready, Michelle? Mm-hmm. Okay. So how did that feel?
It felt good. It just felt like a little bit of suction.
So the skin is getting pulled into that little chamber, and it just feels like a little warm massage. She'll have a little bit of redness afterwards, a little bit of swelling, very minimal, and it usually goes away within a couple hours.
So Lily, what can patients expect right after the treatment? Is this something that they can do on a lunchtime? Is it something that they need to plan for a weekend? What's Michelle going to be able to do once we finish the treatment today?
Yeah, they can definitely do it on a lunchtime. I will have to remove the makeup in that area, but they can definitely put it back on afterwards.
Okay. So it seems like it's just very okay to resume normal activity following this treatment. So lunchtime activity for everyone out there. This can be done on a lunch hour, no downtime, virtually painless, and a really quick and effective treatment to really start stimulating collagen production in the skin. And like Lily mentioned earlier, everyone needs collagen production. Everyone can benefit from it.
Second question from Robin. How many sessions does it take to see improvement?
We recommend about 6 to 8 sessions, but it's not where you see results right away. It does take a couple of weeks because you have to let that collagen, kick in and stimulate, and then let your skin tighten up. So it does take a couple of weeks before you see the results after your 6 to 8 sessions.
Fantastic.
So definitely a cumulative treatment. It's not something like a filler treatment where we go in straight away, the results are immediately transpiring. This is definitely something that builds. The collagen builds and builds. So it's definitely something that you have to be patient with, but the results after that term are so fantastic. So Lily's weighing in with Michelle, just making sure that the temperature is not too hot and making sure that she's comfortable throughout her treatment. So Michelle, how you feeling?
I'm feeling good. It feels good. It's just, warm and with suction. So it's relaxing, really.
The hearts are coming in. And Robin has a follow-up question. How long do you wait in between treatments?
You can do it as soon as 3 weeks.
3 weeks.
Yes. And once you're done with your sessions, results do last 12 months.
So Lily, is there a good time frame that our patients should get this in? I mean, should they do it 3 weeks apart? Should they wait a little longer? What's kind of the best practice for that?
I would do it every 3 weeks to start with, and then after that, just to maintain it, like after their treatments, do them 3 to 6 months apart.
Okay, there you go. So a few treatments right off the bat, kind of close together, and then thereafter you really just go on a maintenance routine with this, just to maintain those great results that you get.
Michelle, how are you doing?
I'm doing really good. Doing really good. Feels good.
No pain whatsoever.
No pain.
Excellent. Hear that, everybody? Pain-free treatment.
So Lily, is this good to do in conjunction with anything? Is there any anything that this pairs well with, or should they just come in and just do a Luma? Kind of tell our viewers, what the course of action is.
Well, the good thing about a Luma is you can get really close to the eyes. So with other lasers, because goggles are in the way, you can't get so close to the eyes. So this treatment is really good to get under the eyes. So for example, on Michelle, I'm getting really close to her eyelashes. Other treatments you can't get so close because you have to be on the periosteum. This one you can get super close. So she's going to get really good tightness. And a lot of people are concerned with the little fine lines that you can't do with filler. And
that is so true.
This is a good treatment for those little fine lines that filler can't get.
Lily is so correct when she says that. This is a great treatment for getting just right up underneath the eye. And I'm not sure if you can see Vanessa, but she really is just right underneath the lash line. So she's super, super close, taking care of all of those little pesky fine lines and wrinkles that transpire right underneath the eye. Sometimes you get that crepiness with it that you really can't go after with a filler just for general safety concerns. So this is a great treatment to be able to get as close as possible.
Wonderful. So Deanna has a question. How would I know if I'm a good candidate for this treatment?
That's a great question, Deanna. Lily, who's a great candidate for these treatments?
Anybody that has a little bit of, lax skin that needs a little bit more tightening. And I mean, it doesn't just have to be the eyes. It could be around the mouth. It could be in the jowl area. We can even do it on the neck.
Wow.
So anybody that needs a little bit more tightening in this area.
Is there anybody that shouldn't do a Luma, Lily?
No. I don't think so. I think pretty much, of course, if you're pregnant or nursing, you can't do it, but pretty much anybody can do it.
A universal treatment.
Right. So outside of pregnant or nursing, anyone can do a Luma. There's really no contraindications with it. It's a very safe treatment. So really everyone can do it effectively and, without worries.
Excellent. So we've gotten some new viewers since we started. So here we are doing an Illuma treatment. And Lily, do you mind just kind of going over what exactly this is, just for our new viewers?
So it's a radio frequency laser, and what it's doing is it's stimulating collagen. So by stimulating collagen, Michelle is going to get tighter skin under the eye area, which is going to help with the little fine lines that she has there.
And Lily is right up in the eye. This cannot be done with any other laser.
No.
Everyone, I want you to see the magic that's happening.
Yeah, Illuma's probably the only laser you can get this close with.
So for our new viewers, we are talking all things Illuma with our lovely registered nurse, Lily. For those of you who are just tuning in, Illuma is a laser that is going to stimulate the collagen production in the skin. So truly, everyone is a great candidate for Illuma. Anyone can use Illuma, and we really can do it in multiple areas. Anywhere that has laxity or has lost, a fair amount of collagen production, we can re-energize that collagen production in those areas. So who's got questions about Illuma? Is anybody else concerned if there's any other areas of the body that you can use it on? Is it just face? I know you guys have to be wondering. So Lily, can someone else use this in maybe an area on the body that's lost laxity?
I think we have better treatments for that, just because of the amount of the head is pretty small. So it's better used for smaller areas, for like the face, the neck. I think it'd be better just for those areas because, we do have other lasers for the body areas.
Definitely. So we're going after small targeted areas with the Illuma. If we need to address larger areas of the body or areas that have lost laxity and we're going after a large amount, there are certain other things that can treat that effectively and very time efficiently as opposed to Illuma. So we have all of that here underneath one roof here at Butology. So it really is great that we have everything to offer Bakersfield for all areas of concern.
Fantastic. Now, what are prices like? I know that's always a question some people are hesitant to ask, so I'm asking this on behalf of everyone.
So Illuma treatments, they range from a couple of $100s. I mean, typically with Illuma treatments, because you are going to need, a consecutive amount, and the average person needs about 6 in order to really jumpstart collagen production and see amazing results. So packages are always the best route to go. It's the most way to save and to kind of bulk in your sessions and really get a large savings from that. So we do several package options in addition to a Lux membership, which is basically with a Lux membership, you pay a monthly rate and you become a premier member with us. And what that's going to get you, I know, Vanessa, you're excited. What that's going to get you is discounted access to all medical spa facilities and treatments, in addition to a couple of treatments that you get gratis every single month.
Wow.
So, your monthly fee really serves its purpose and gets you the lowest pricing possible and a couple of extra perks as well.
Oh, you got thumbs up on that, Heather.
I know. B12 shots, everybody does them. I know you all do them, viewers. So you're going to get B12 shots with that. You can even do an endermology session per month, which is great for cellulite all over the body. Or you can trade them out for cryofacials, which is a great way to also stimulate collagen production in the skin, help with pore size, help with fine lines and wrinkles, and also give you a nice kind of euphoric feeling where you just feel like you want to go out and run a marathon.
Woo!
So,
thumbs up to that. That was a popular statement, Heather.
Definitely. So there are certainly many options in order to get this treatment in a really cost-effective manner for all of our Facebook viewers.
Fantastic. Now, Lily, how long is this treatment usually if we're just doing under eyes here like we're doing with Michelle?
Like 20 to 30 minutes.
Great. So like Heather had mentioned, definitely lunchtime procedure.
Absolutely a lunchtime procedure.
And still, here we are, Michelle. We're quite some minutes into it. Any pain?
No.
Be honest.
No, I'm honest. No, there's no pain.
That is great.
So Michelle, what were your concerns as a patient coming to Beautology, and what kind of brings you to undergoing the Illuma treatment, which was, I have to say, viewers, this was her choice. This was the treatment that we recommended to her as our patient in order to obtain the optimal results. So Michelle, if you don't mind, if you can, share with our viewers a little bit about your story and your concerns.
Well, I'm getting older, and you lose the elasticity in your skin, and I've always had I've had some fine lines going on with my eyes, and I thought this would be a very good treatment. And like Lily said, you can get close to the eyelashes, so I thought I would try this. And it's very comfortable. I'm excited to see.
Wonderful. So here's a question from Robin. This is for Lily.
Oh.
Will she have any redness after treatment?
As you can see, she has very minimal redness and just a little bit of swelling, which will go away within a couple hours.
Oh, a couple of hours.
Yes.
Wonderful. So off to dinner Michelle goes this evening.
And Lily, is it safe for Michelle for her dinner plans this evening to reapply her makeup? And is there anything she shouldn't do tonight?
We just, we don't want her going and running a marathon or going and running on the treadmill for an hour, but she can, do, light walking and, light exercise, but nothing too intense. She can put on her makeup, just, take it easy for the rest of the day. She can go back to work if she needed to.
So as you can see, we do have a little bit of pinpoint swelling underneath the eye area, and there is a little bit of redness. All will dissipate really soon for Michelle, but that just kind of goes to show you the amount of suction that we're getting there, and really, really stimulating those fibroblasts to start rapidly producing collagen. So all of this is definitely for a reason, and all of it will dissipate really, really soon for Michelle. So she looks just as beautiful as when she walked in.
She sure
so
does.
She can definitely go out to dinner and go on about her evening. Michelle, do you have any other areas of concern that are lacking, lacking elastin or anything that you feel is getting a little bit creepy on the skin?
Oh yeah, my neck, definitely. That seems to be an area that I really need to work on.
So Lily,
Definitely
would Michelle's concerns with her neck, would that be something that we can address with the Illuma too?
Yeah, we can do the Illuma on there.
Definitely.
Wow.
So it might be great if we just kind of move on down and we just give Michelle the full treatment today. So again, we're just repeating with that conductor lotion on the skin. That way we can get a nice great suction and really get her the most effective results. So Lily, what are you doing now?
Yeah, what's going on over here, Lily?
So I'm changing the head to a bigger handpiece because that one was smaller just for the eyes. So this is for a larger area like the neck.
All right, you got a thumbs up on that, Lily.
So it's always great when your aesthetic nurses are really in tune with not only the technology that we offer here, but everything on the market, because that way they can really determine what's going to be best for our patients in order to get the results that they're looking for. So Michelle's concerned with the neck area. This would definitely be something that if she were in-house any other day, we would absolutely recommend to her. So we're going to go and address those kind of the fine lines and the crepiness underneath the neck area, even though Michelle doesn't look a day over 21.
No, look at her.
It's something that she wants to address, and it's something that we can very quickly address with the Illuma. So Vanessa, do we have any other questions coming in? Come on, Facebook, it's Friday. You guys are feeling good?
They are certainly sharing the love via thumbs up and hearts, but there are questions that they are just holding back on. Come on, viewers.
We love your questions, and it's always great to get really sound advice from our staffing that does it hands-on every single day. So
yes.
Lily is a registered nurse here at Butology, and medical aesthetics is her specialty and her forte. So she really gets to have the interactions with the patients day in and day out. So she sees it all, and as a result, she's just a wealth of knowledge and what's going to be best for patients.
Absolutely. So here Lily is working on the neck area. How does that, now this is a new area, Michelle, how does it feel?
It feels good.
Okay, great,
No
great.
pain.
So for those of you that are just tuning in, we are talking about all things Illuma with our nurse Lily here at Butology. As you guys know, Facebook Live has become a thing for us on Friday, so expect to spend your Friday afternoons with us all the time. We love chatting your guys' ears off, hearing your questions, and educating you towards all the things that are out there. Technology has come such a long way in the medical aesthetics industry, and we really do have a laser or a treatment or an injectable for really everything.
Fantastic. So we do have a few questions now coming
Okay.
in. So from Robin, are there other treatments you could use to address the neck concerns that Michelle has?
Yes, we do have other lasers such as the Venus Viva. It also tightens the skin, and it works in a different way.
Which way does Venus Viva work in, Lily?
So the Venus Viva, so this one's working on the epidermis. On the epidermis of the skin. The Venus Viva bypasses the epidermis and goes straight to the dermis. And you need less sessions. Downtime. You have a little bit of downtime with that one, 24 hours. This one, there is no downtime.
Fantastic. And we have Dahlia tuning in. She said, just tuned in. What is this treatment for?
Dahlia, welcome. This is Illuma. And Illuma is basically just a really hefty collagen production booster. So it kind of just takes the skin and really amplifies the collagen production, kicks it into overdrive so that we start rapidly producing collagen and we can turn over nice, new, healthy, wrinkle-free skin. So Lily, can you weigh in for Dahlia and our new viewers about what Illuma is doing in a bit more of a clinical fashion? That way they can understand the science behind it.
Yes, so Illuma is a radio frequency laser, and what it does is it stimulates collagen. So it has a little suction, and what it does is it brings the skin into the chamber, and it releases the radio frequency waves. And so by releasing the radio frequency waves, it's stimulating collagen. And with collagen stimulation, you're going to get skin tightening.
Who doesn't love that? Hashtag skin tightening.
Right. And by bringing that skin up into the chamber, everyone, you're getting it right up against that radio frequency. So it's the most effective that it can be. Whereas other types of treatments that are anti-aging, really, I mean, you're not getting close enough to the skin to really promote change. So Illuma is really getting directly to the source and going right down to the epidermis in order to start rapidly producing that collagen. So really, as Lily talked about before with some of our viewers who have been in for a while, everyone is a great Illuma candidate, no matter if your area is underneath the eyes, if you have a bit of crepiness in the jowl area, or even the neck area like we're treating with Michelle right now. As long as it's a small area and laxity is the issue, we can absolutely go after it with Illuma.
Fantastic. So Dahlia was super satisfied with that answer. She loves it.
Dahlia, we love you.
Yes. And we have another question. This is a great one. What is the difference between Illuma and Venus Freeze? This is from Alice.
Great question, Alice. So I'm going to let Lily answer that. That way she can fill you all with clinical information about the differences between the two, because there certainly are differences.
Yes.
So they're both radio frequency lasers, just the way the treatment is done is different. So the Venus Freeze is a multipolar device, and it also has magnetic pulses. So not only does it does tightening, it also kind of heals the skin at the same time. That one kind of feels like a hot stone massage.
Ooh.
And we can do a lot of different areas with the Venus Freeze. We do a lot of body areas like the stomach, like the thighs. Whereas the Illuma, we focus more on smaller areas because it's a smaller handpiece.
So with Venus Freeze too, Alice, I love your question, by the way, because I love some Venus Freeze. Venus Freeze typically we use to tighten and tone the larger areas of the skin. So not only will we be addressing, the laxity issues, but we'll be addressing, fattier pockets or areas that have the dimple effect on the skin. So this is really just going after the laxity of the skin and really boosting the collagen production. So, well, we could certainly kind of use the two interchangeably at some points. We like to use Venus Freeze for other larger areas of the body, and Illuma for spot treating.
Excellent. Now, Lily, what are you doing now?
I'm gonna do another pass.
Okay, another pass. Ooh.
Get her a good result.
Yes.
So I usually do about 3 to 4 passes on the neck. On the eyes, I did about 4 to 5.
Okay.
So, Michelle, how are you feeling now that you've had an under eye treatment and we've done a single pass underneath the chin?
I'm feeling good. I will say the under the chin, it's a little bit more sensitive than my eye area was, but it's still not painful. It just pinches a little bit more.
Okay.
How comfortable would you say this is on a scale from 1 being extremely uncomfortable and just you're ready to just fall out of the chair, and 10 being very, very comfortable, very tolerable, and you're on cloud 9?
I would say a 9.5.
Wow.
Hey, we'll take it. So not quite, she's not on cloud 9, but she's certainly really close.
Yeah, definitely.
So it's a very tolerable treatment. We've referred to it earlier on in the segment as a lunchtime treatment because it's a very quick and effective treatment. I mean, Lily treated Michelle's under eyes in just about 15 minutes. It seemed like. I think we were just at the 15-minute mark. So something that can be done really quickly. Michelle can still go out and enjoy dinner this evening, go out in public, and there's absolutely no downtime with this laser. So it really is a great alternative. No questions, Facebook. You guys are sleeping.
I think they are ready for a nap, it sounds like. But we definitely have our viewers tuned in, so.
Good.
Remember, everybody, no question is a silly question. We're here to answer them. We have Lily, our registered nurse, who is full of knowledge.
Right.
And shout out if you love Lily. Oh my gosh. We know she has so many followers out there.
Lily does. Lily has a huge following. All of her patients really love Lily because of her really sound, solid advice. I mean, she truly is, she gives a really non-biased opinion, and it's just, she really is just filled with knowledge. Even though she's very quiet, so you'd never know it. But I call her my silent killer because she'll just bust out with all that information.
Yes.
And you would just never even know if you saw her just talking to her because she's just so quiet. But her patients love her. They love her gentle touch. She's very light-handed, and she treats everyone like gold. So Lily's one of our amazing aesthetic registered nurses here at Beautology.
Absolutely. She got a shout out from Alice. Lily's the best.
Lily is the best. See, Alice probably knows just as much as I do. Silent killer, this one over here.
Yes.
She's an amazing nurse, and she's been with us for several years and many, many more years to come because she really is amazing at what she does.
Fantastic. Now, Maribel has tuned in, and she would like to know the price.
So Maribel, pricing definitely ranges for these. Usually an Illuma treatment is a couple $100. Anywhere from 6 to 8 sessions is typically what we recommend for our patients for best results. The most cost-effective way to do it is to either do a package of sessions, that way you get a nice hefty discount, or to become a Lux member, which is a really small monthly fee that gives you really discounted prices to everything medical spa related, and it throws in some extra perks monthly that are just complimentary for being a Lux member, like weekly B12 shots or an endermology session for the month, which addresses the cellulite and goes in to loosen up those bands and really give a nice soft supple look to the skin. Or you can come in and do a cryofacial every week, which is going to stimulate collagen production, shrink the pore size, address fine lines and wrinkles, and also make you feel like you're just ready to go out and run a marathon. So all of those ways are going to be the most cost-effective way to do it.
Great. Now, Robin is asking, Lily, does this help with under-eye wrinkles?
It does.
Ooh.
That's what we're focusing on Michelle, the little lines that she has under her eyes. And we got really, really close up to her, almost up to her lash line right there.
Wow.
So this is one of the few lasers that can help with under eye wrinkles.
Hear that, Robin?
And you'd be really surprised. We hear a lot of that from our patients. A lot of our patients come in and they have the creepiness under the eyes, and that's the area that they want to address, and that's the area that concerns them the most. And I mean, really, Lily, there's not really any other way to get so close to the eye. I mean, you certainly can't do it with an injectable treatment. You really can't do it with any other, type of a ablative laser. This is really a great option. All right, guys, it looks like we've just exhausted a lot of our time today. So we love spending Friday with you. We love talking about all things Illuma. Thank you to our beautiful patient, Michelle. Do you see, she made it through. She made it through, no complaints. She's all smiles here, a little bit of flushness that's already going down.
Yes.
The swelling's already going down as well. So lunchtime treatment, great for everyone. And you'll love it. You'll love Illuma. Okay, guys, I think this is time to tune out for the afternoon. So everybody get your naps in. We'll see you next week for Facebook Friday.
Bye-bye.
Have a great day.